Hotez, please type it in the chat line. I hope everybody has access to that. So if someone wants to start it off with a question, that would be great. I don't know if everyone can hear me.
I can hear you.
Okay.
I see lots of responses that people can hear.
Okay, great. Oh, well. Okay. Good. So we're just waiting for the first question. Okay, we have our first question.
So an update on the hookworm vaccine.
Yes.
Sure. This is a vaccine that's been in development for a few years. It's a bivalent recombinant protein vaccine, and it is now undergoing clinical trials in Brazil, in rural Minas Gerais state in Brazil. And so far, knock on wood, which I'm doing right now, it seems to be, so far it's safe, and we're now going to be expanding our clinical trials with new support from the European Union, specifically to do clinical testing in Gabon in collaboration with the Lambaréné Research Center, the Albert Schweitzer Hospital. So I'll make my first trip to Gabon in the fall, and that's very exciting since Albert Schweitzer is a lifelong hero. I'll finally get to visit the Albert Schweitzer Hospital. So the clinical trials are up and running. We've got some new European partners through what's called the HOOKVAC Consortium. And it's spelled HOOKVAC, and you might want to take a look at that on our website. And that's so we'll be continuing our clinical trials in Gabon.
Great. So I have a question.
What got me started on neglected tropical diseases? Well, that's an interesting story. It's I don't know how good a role model it is for everyone, but I've had a passion for tropical disease since I was 12 years old, and read Microbe Hunters and decided that's what I was going to do with my life. So it was a combination of a fascination with maps. So I'm one of those nerdy kids as a child, and got interested in tropical disease early on, and began working in a research laboratory at Yale as an undergraduate on African sleeping sickness, and it went on from there.
Great.
Greatest accomplishment? Well, that's an interesting one. I think, a couple of things. One, raising the awareness about neglected tropical diseases, helping to formulate the concept of what NTDs are as this group of chronic and debilitating conditions that occur predominantly in low-income countries, that could be targeted, many of them could be targeted simultaneously with a package of medicines. So coining this term, the Rapid Impact Package and NTDs, and putting that as a series of back-to-back papers in the Public Library of Science, and then doing the advocacy to go along with it. And I think one of the reasons we were effective as advocates was because we were scientists working on these actually working on these diseases. So we, and I mean myself and people like David Molyneux at the Liverpool School of Tropical Medicine and Alan Fennick at Imperial College London were scientists who simultaneously became advocates, global health advocates. And that turned out to be a very powerful combination for getting NTDs on the radar screen. And within a few years, we had reached 100 million people with the Rapid Impact Package, and now USAID reports that more than 1 billion people have received partial or complete Rapid Impact Packages targeting the intestinal worms and schistosomiasis and trachoma, lymphatic filariasis, and river blindness. And in parallel, we've always tried to stay true to the science. So one of the hardest things I do is to keep a foot firmly planted in both arenas, meaning to do global health advocacy, but at the same time still try to be a working scientist. And that's very challenging because one requires you to be everywhere but the laboratory, and the other requires you to be in the laboratory. And so there's always kind of an inherent conflict. But it's something I find very rewarding to both be a scientist making vaccines for neglected tropical diseases, and now we're having some success at getting these vaccines into the clinic. I see one question here. What is the best piece of career advice you've ever received? I don't know about career advice receiving. I think if I had to give career advice, I would say it's the concept of resiliency. That remember, everybody goes through difficult periods, and resiliency also means having a certain amount of self-confidence and not getting too downtrodden in response to your peers and how other people judge you. And I remember one of the stories I like to tell is that there was a period of my time when I was a junior faculty member at Yale where I was having terrible trouble getting my NIH grants renewed. The NIH study section didn't like the fact that I was trying to turn my science into making vaccines, and I wasn't getting funded. And I actually, had started thinking about whether I was going to be able to make a career in science. So just by being tenacious and keep working at it and recognizing that, look at the most successful people you know in global health, and I can assure you that they've gone through periods of great crises and confidence and periods of time where they didn't know if they were going to be able to make it, and realize that everybody goes through that. So that's one piece of advice. I can't read the second part of the question there. You want to read that, Alexis, to me, or? Yeah, I can't read. It just says, or as students, all I can read on my screen is, as students interested in N. Let's see if I can read it on the other.
Sorry, Dr. Hotez. So as students interested in NTDs, what are some of the most important skills we should take away from our training to become successful advocates and researchers? Oh, Dr. Hotez, you're muted again.
Okay, am I back on?
You are back on. Great.
Yeah, I think, people often ask what kind of training should people get if they want to work on NTDs or global health. And, the field has gotten so complex that the idea that you have to be a scientist to work on neglected tropical diseases or global health is no longer the case. Global health's become a very complicated ball of string, and we need people coming at it from many different angles. So one of the things I tell people in global health is, one way to go is to become a physician or healthcare professional but it's by no means the only way. You look at almost any field of endeavor, and I can find a global health spin on it. So we need lawyers, who are well versed in international law and patent law. We need engineers, especially that are going to focus on innovative approaches to environmental control and sanitation. We need social scientists. We need political scientists because there are enormous political barriers to NTDs. We need economists. One of the reasons I think we were successful in getting this whole neglected tropical disease movement launched was we partnered with people like Jeffrey Sachs and other macroeconomists to show that NTDs not only occur in the setting of poverty but cause poverty. And so working with members of US Congress or the British Parliament, it was very important to have economic arguments in hand. So really almost, if you're passionate about global health, do not feel like you have to be pigeonholed in one particular area, and that you can get trained in almost any field of intellectual inquiry, and you can make an important contribution to global health.
Great. Thank you so much, Dr. Hotez. We have a lot of comments about how great your answers have been, very heartening for the students. Following up on that question, so how do you envision engineering and technology can help in this area of tropical diseases? We have some engineers in the audience that are curious to know where they might fit in.
So that's a great question. So let's kind of go through the list of the different types of engineering. Control and sanitation systems, WASH, this whole acronym of water and sanitation and hygiene. That's really an engineering problem in many respects. In fact, if you look at the foundation of the early public health movement that started at the turn of the 20th century, there was a lot of question whether public health schools should be based in schools of medicine or be based in schools of engineering. And in fact, one of the first schools of public health was based at MIT. Not many people are aware of that. So that's one aspect. Biomedical engineering, to design new devices, medical devices, including devices for diagnostics. Same with mechanical engineering. So the engineers could have a very profound impact. And many of you are aware there's this organization called Engineers Without Borders, and they're making important contributions to global health, but also to international development. So that's extremely important.
Okay. So we have a question about Chagas disease and the career potentials for Chagas disease research and epidemiology in the U.S. Especially since this disease is gaining some attention now here in the U.S. So can you sort of comment on the state of Chagas research here that you know of?
Sure. When I say when we talk about Chagas, I guess we should talk about this whole issue of neglected infections of poverty in the United States. I still think poverty is a major and overriding determinant of neglected tropical diseases, in some ways even more than climate change. And wherever you find profound poverty, you find these diseases. And not many people realize that we have about 1.65 million families in the United States that live on less than $2 a day. And so, we have around 5 million Americans that live at a level of poverty that's equivalent to poverty you'd see anywhere else in the world. And with it, we have neglected tropical diseases that are not rare. So we have dengue fever all along the Gulf Coast of the United States. In fact, we have an article that just came out last week on the Gulf Coast, on neglected tropical diseases along the Gulf. We have Chagas disease in Texas and elsewhere in the southern parts of the United States. And I think one of the important, toxicariasis is another one. Cysticercosis, I call them the most important diseases you've never heard of. And as a result, I've now, in our latest article in PLOS NTDs, called the 10 Global Hotspots of Neglected Tropical Diseases, we list our part of the country as one of those hotspots, which is kind of a provocative thing to do. I think one of the big unknowns is, that many organizations assume that all of these diseases are due to immigration, whereas we flip the other side and say, no, we think with this determinant of poverty that these diseases are widespread because of transmission that's occurring in the United States. So for instance, 1 in 8 dogs in South Texas is infected with Chagas disease, while the dogs did not slip in across the border from Mexico and El Salvador. We have transmission of these diseases. And in fact, what we're doing on Capitol Hill on July 23rd, I believe is the date, is there's going to be a summit on what's called border health. And I'm going to talk about neglected tropical diseases. And the major point I'm going to make is that it's not so much diseases coming in across the border from Mexico. It's the fact that we have the same social and physical determinants of poverty and disease in the U.S. side as we do on the Mexican side, and therefore we have those diseases.
So we have a question from a public health policy student, and she wants to know what are some of the arguments that you presented as part of your advocacy work to gain political traction for global health, especially here in the U.S.
So this is one of the real surprises. We had some success in 2005, 2006, getting NTDs on the radar screen of Congress and also the British Parliament, and it created a buzz, and we got the celebrity community involved, and so you can argue the term neglected tropical diseases may not be the best term, but everyone seems to know what we're talking about with NTDs, and we're a bit afraid to mess with it now. So everyone knows what NTDs are, at least to those of people who are interested in global health. But I thought when we uncovered what was a previously hidden burden of disease and poverty in the United States, and we're finding neglected tropical diseases here, and I first wrote about it in 2008, we thought that would really get things to take off. And in fact, the opposite has happened. It's been much, and for me, it's counterintuitive or paradoxical that it's been much harder to get the concept that we have disease and poverty and neglected tropical diseases here in the U.S., especially along the Gulf Coast, than I ever would have imagined. It's almost as though people do not want to admit we have disease and poverty in this country. And so it's been a real struggle getting the word out about these diseases here in the United States. Far more difficult than I would have imagined. So I'm open to suggestions of what, I'll be the first to admit we're doing something wrong on the advocacy front, getting the word out about these diseases, because people still do not realize that we have that dengue and cysticercosis and Chagas disease and toxoplasmosis are not rare diseases. They're quite
following up on that question, how important do you think it is to engage the general public in terms of support for these issues, and what do you think, in your experience, has been the best way to go about doing that?
So I think engaging the general public is absolutely critical. In fact, I consider it an obligation by scientists, which is not something they teach you in graduate school or medical school or engineering school. And I cite numbers that have come out of one of my favorite organizations based in Washington, D.C., Research America, that found not too long ago in their survey that 70% of Americans, 7-0, cannot name a living scientist. And of those who could, Stephen Hawking was number 1, but Bill Nye the Science Guy was number 2. They also found that a significant number of Americans believe that Albert Einstein is still active, and 60% of Americans cannot name an institution where biomedical research is conducted, and fewer than 9% of Americans ever heard of the NIH. And that's, so there's an extraordinary amount of science illiteracy in this country. And I turn it around a bit and I say I blame us. I blame the scientific and public health community. We don't be proactive at getting the word out, and that's why I'm really redoubling efforts to stay engaged in social media, being active on Twitter, being active. We have started a new website of my open access writings and public writings, just peterhotez.org, and keeping the Twitter account alive and doing public speaking whenever I can. And I also think that's something we need to do among young people. We need to encourage uh, graduate students, medical students. We need to encourage postdocs, residents to be engaged and get the word out, which is not something that's currently done. Most deans would cringe at the idea that a young person is spending time doing social media instead of writing grants and papers. And I say one of the reasons why we're in this mess and why we've had flatline science funding for the last 15 years is partly because of those attitudes. So I'm a dean now, and so uh, I'm trying to buck the trend a little bit and making all my junior faculty have a social media presence, encouraging my
Would
students
you
to do
advocate
this.
then also getting people involved more earlier, so more STEM education, middle school and high school, exposing that level of education to?
Yeah, that's actually a very good point. So I wrote this article that not too many people responded to, although I think it's a good idea. You know, now that uh, American science is in such difficult straits with the flatline funding from NIH for the past 15 years, we have a risk now that young PhD scientists may have difficulty in finding employment in their profession. So I've made a suggestion that we create a whole cadre of postdoctoral scientists, advocates that work in the high schools to teach science education, teach STEM education. And I've proposed, and I wrote this up in PLOS, Speaking of Medicine, and I called it the Richard Feynman Postdoctoral Fellowship in Science Advocacy and STEM Education. The idea hasn't really caught on, but I think we need to do something because we're clearly, as a country in the United States, we're losing science supremacy. Reuters Thompson has recently shown that the average impact factor per scientist, the United States has gone from number one, where it's been ever since anyone can remember, and when the recording was first done, to number three behind the UK and Germany. And now, of course, China is rapidly ascending, and they could be number one.
All right, so switching gears a little bit, someone wanted to know about your experience working within the global network of public health has been. What kind of cultural issues have you seen in terms of implementation, and which countries have been instrumental in pushing for an end to NTDs?
Well, I think one of the big challenges we're facing now is, and this is just an idiosyncratic opinion, I wouldn't say there are many who would disagree with me, but I think the global health community has become a bit ossified. By that I mean we've got these structures in place um, for HIV/AIDS, for malaria, for tuberculosis, for NTDs, and people aren't talking to one another. So the AIDS people don't talk to the malaria people, the malaria people don't talk to the NTD people. Actually, nobody talks to the NTD people. And an example of that is we've seen this problem of female genital schistosomiasis, which I estimate is the most common gynecologic problem in Africa. It's now been linked to a 3 to 4-fold increase in HIV/AIDS. I believe it's one of Africa's most important cofactors in its AIDS epidemic, and it's now Alison Galvani's group at Yale has shown that its schistosomiasis control is as cost effective as male circumcision, and you cannot get any acknowledgement from the global AIDS community, either from PEPFAR or the Global Fund, that this is an avenue worth pursuing. And when I've spoken to people from PEPFAR and the Global Fund, it's been very, very frustrating because they'll call it mission creep, that taking out schistosomiasis. And I said, well, it's not mission creep if it's part of the mission, because it's Africa's most important cofactor in its AIDS epidemic. So that's been one of the something that I think we need to figure out how to, now that there's some money in the system, and there's been important structures been put into place. I mean, the PEPFAR track record, the Global Fund track record is extraordinary, but their unwillingness to embrace NTDs I think is a reflection of a certain amount of ossification that we're seeing in the system.
So I have a question for you. I want to know what keeps you awake at night. What are you worried about in terms of the future of NTDs and the research community and advocacy community around it?
Well, of course, one of the things we worry about is losing momentum, and that's something that we cannot allow to do. So far, the U.S. government has been good about appropriating funds. I kind of laid out my concerns and things that keep Peter Hotez up at night in a paper that came out in PLOS NTDs at the end of last year, and it's called NTDs version 2.0, which kind of lays out the things that should be happening that we're not doing. And so among them include the fact that we're now treating hundreds of millions of people on medicines. We know from past global health experiences that resistance there's a high risk that drug resistance will be developing, and we're not being aggressive enough on doing the other part, which is doing research and development for backup tools, diagnostics, drugs, vaccines, which is something we're trying to do in the laboratory. I think that's not happening like I'd hoped it would. I think another piece is failing to recognize that looking at the NTDs as a girls and women's issue. These are the most common afflictions of girls and women living in poverty. I've already spoken about female genital schistosomiasis, but also the fact that hookworm is the most common complication of pregnancy, or the fact that you have more than 100,000 young women with Chagas disease passing their infection onto their baby. So failing to recognize that these are important girls and women's issues. Also, there are important NTDs that we realize from our Global Burden of Disease Study 2010 that are high DALYs, disability adjusted life year NTDs, as high as hookworm or schistosomiasis that cannot be targeted by mass interventions at this time. So we need to keep sight of those. So these things like leishmaniasis, which is now emerging as the most common affliction of people in conflict and post-conflict settings, or Chagas disease, or the fact that we're in a dengue pandemic now with more than 400 million people infected. And finally, it's the recognition that while NTDs are an important problem in sub-Saharan Africa, paradoxically, most of the world's neglected tropical diseases are in G20 countries, group of 20 countries, meaning that the 20 wealthiest economies bear the lion's share of NTDs such as leishmaniasis and Chagas disease, and dengue, and lymphatic filariasis, and several others. And so, this whole concept of developing versus developed, I'm now starting to think that's kind of your father's global health. That in fact, what we're seeing now is the world has changed. It's wherever there's intense poverty, and I've given a new name to this called blue marble health, that it's this concept that it's not developing versus developed, but we have pockets of intense poverty in their G20 countries, so that we need to push the leaders of the G20 to take on greater responsibility of eliminating their own NTDs. And with that, those G20 countries, of course, include the Indias, the Indonesias, and the Chinas of the world, but also even countries like the United States, which are doing very little to take on their own NTDs. We're doing very little to do help.
So, I have a question here from another student who asks about balance. So, we are all interested in global health and advocating for global health. But as a student or a trainee, how do you balance opportunities and exploring opportunities outside your research with your ability to complete your projects and your research? And I know it might be hard because I'm still convinced that you don't actually sleep, but how would you recommend students go about balancing being involved in things like ASTMH and the work that they have to do in the lab?
So that's a great question. It's something that quite frankly, I still struggle with today, and I live with constant guilt because so I'll give you an example. There's a wonderful.
Dr. Hotez, your mic went out again. Back on.
Come on, back on. Okay, so yeah, so it's something I struggle with every day, how to balance being a working scientist with being an advocate, and I'm constantly having to make difficult decisions. So I'll give you a good example, which is that there's an extraordinary event happening in Washington, D.C. this Friday at the World Bank to commemorate the 40th anniversary of river blindness control efforts using ivermectin. And people I admire enormously, Don Bundy and Jim Young Kim and Roy Vagelos will be there. And one part of me tells me I should be at that event. On the other hand, the other side of me says I've been traveling too much as is, and I need to stay at home and focus on the lab, especially because I have to be in Asia in July. So I had to make a very difficult decision not to be at that event. So it's hard work trying to balance both, and it's one of the hard. And if you notice, a lot of the people that I admire the most as global health advocates, they don't have a lab, and they've stopped being working scientists. But it's not something I'm prepared to do. I'm still
Well,
too
that's actually
passionate
very
about it.
nice to hear because I think we all, when we're trainees, just assume that our bosses have it all figured out. So sometimes it's good to hear that everybody has the same struggles.
No, in fact, I was really grateful you didn't ask me the question about how I balance work and family, uh, as I consider myself the most
So we
unbalanced
have a
individual.
follow-up on the engineering question for you. One of our engineers would like to ask if there are unique aspects of developing techniques for NTD diagnostics that you'd like to share, just sort of some generalizations for people who are interested in some things to keep in mind when you're trying to develop an NTD diagnostic.
Yeah, I mean, I think that's a good question. The diagnostics that we have for NTDs, you have to remember, most of them were developed in the Pleistocene era, right? I mean, they're developed in the age of the dinosaur, where you still used extracts of living parasites or living microorganisms on the ELISA plate or on the Western blot. And as a result, one of the big problems that we have is the diagnostics are not accessible, either because they're only available in a few specialty laboratories, or um, uh, because they're not widely available. It's when you know how it is when you go to see your doctor and you need blood work done, and you get handed a lab slip from Quest Diagnostics that has a bunch of boxes that are checked off for your CBC or your chemistries and your liver functions. Well, we don't have those tests for the NTDs because they're so inaccessible. So this in itself contributes to neglect. So if you almost any neglected tropical disease you name, whether it's Buruli ulcer or toxocariasis or schistosomiasis, I will say to you that there's an urgent need for new and better diagnostics. Now, in response to that, there's been a very nice product development partnership created in Geneva called FIND. It goes by the acronym of FIND, which stands for the Foundation for Innovative Diagnostics. That's a very important organization. It's not the only one. So the original mission of PATH, the Program for Appropriate Technology for Health, was around diagnostic technologies, but we need more of that. So, and usually diagnostics are not as lengthy in terms of to get licensed or to get out there as, say, new drugs, or certainly as new vaccines are. So I wouldn't say they're low-hanging fruit, but I think there's so much more we can do now in terms of microfluidics and other cutting-edge technologies that are not being applied to neglected diseases. So we've now been partnering with a fascinating group of chemical engineering. And so here's an example of an engineering again. There's the chemical engineering group at the University of Houston we're working with now to look at microfluidics and other cutting-edge technologies for diagnostics. And also, my colleagues at Rice University have an organization called Rice 360, which is looking at medical devices, not only for neglected tropical diseases, but all sorts
So
of
have you
global
seen
health
an increase in
conditions.
these types of partnerships? Because I know that I don't think, biologists necessarily will think to go to an engineer sort of as their first thought. And so how can we sort of encourage that type of partnering in the future more?
Well, I think this was something that the NIH had started under Elias Zerhouni, who was the previous director of the NIH. He created this, what's called the NIH roadmap, and now it goes under a different name and it's been expanded under Dr. Collins, where some of the funding priorities are really going to biologists working with engineers and working with physical scientists, because there's a whole new world out there that needs to be explored. And so, yes, I think some of the most successful interactions now are when biologists work together with engineers. If you think about it, our vaccine development initiative is really a chemical engineering problem. So we have chemical engineers that we work with as part of our team that are working on, for instance, expanding the yield of in the fermenter for producing recombinant protein, or improvements in purification, or all the formulation technologies, or all the cold chain. So engineers are at the top of the list in terms of trained people that we need to take on global health problems. And that's part of the idea behind this movement that we've seen a little bit of, called CUGH, the Council of Universities of Global Health, recognizing that just keeping the model in medical schools, we're not going to solve problems. We need, on one side, we need the engineers to work with, but on the other side, we need the social scientists and the lawyers to work with as well. So global health is something that cuts across all aspects of
the next
the
question is
academic
actually a
enterprise.
question that I struggled with, having just come off of my postdoc as well. So, what would be your advice to postdoctorates trying to find their way in global health? Do you consider it a must-do requisite to go back and get an MPH in order to be well fitted to the global health arena?
So the answer is definitely no about the MPH. Well, first of all, let me take a step back. I think one of the great failings of of professors of my generation is we have not really spelled out an easy career path in global health. So there are very few people that can make their living doing something called global health. Everyone has to have a day job, whether it's as a lawyer or as an engineer or whatever. So I think that's the first point. So it's not easy to carve out a career in global health. You have to figure out some way where you're going to get paid on a regular basis and then turn your attention towards global health. And there's no roadmap for that. I think an MPH degree is helpful for some people. I do not think it's by any means a prerequisite. I think one of the problems with the MPH that I see is it's heavily proscribed by the accrediting body. So you have to have so many credits of X, Y, and Z, and you really can't do a deep dive in global health. And that's why we created our National School of Tropical Medicine, while we recognize the great importance that schools of public health bring. We think that's not the only way to do it. And so what we've done now is to create the National School of Tropical Medicine here at Houston, which is offering, for instance, a deeper dive through a diploma in tropical medicine and hopefully new master's degrees. And now I notice that UCSF has built out a very promising Center for Global Health that may morph into a School of Global Health, and that will be the same way as well. So I think the MPH just has some elements that are useful, but other elements that are not really providing a sufficient added value in global health. I also think that an MPH, my personal bias is it's far more powerful when you pair, and I think people in schools of public health would agree, when you pair it with another degree, whether it's a PhD or whether it's another health professional degree. For instance, nurses have an enormous amount to offer in terms of global health, or whether it's being a lawyer or a physician or a podiatrist or a dentist or you name it. I think it's more powerful.
All right, so we have another question that's sort of related to this balance of time in your career in terms of interests. So the question is about balancing multiple interests in a job or field that can do the most good for the greatest number of people. And the questioner wants to know, how do you make your choices on what to focus on, advocacy, research, etc. And do you have any suggestions for people who are struggling with these issues?
So as I mentioned before, this is something with I struggle every day, and what I try to what I try to do is set priorities and set specific goals for myself, and even write them down so so at the end of the year you have something to show for your activities. I think that's very helpful. The second is I think it's very important to have a 5-year roadmap. I think the people that I know that are successful know where they're headed and have a rough idea. It may not be exactly right, but they know where they're going to be over the next 5 years. As opposed to, I can't tell you how many times I have a young person in my office who's gotten all A's in high school and is a merit scholar, and then went to the best Ivy League college or equivalent they could get into, and did really well there, and then they excelled on getting their MCATs or GREs or LSATs, and then they've gone the next step, getting to the best graduate school they can get into, and then they do the best residency or postdoc, and at the end of the time they're lost. They really don't know, they still don't know what to do next. Mm-hmm. So that they're so focused on achieving and excelling at the next grade, the next step, that they really haven't given themselves time to step back and say, where am I headed? And so I see a lot of lost souls, especially at the university, of people who really don't know where they're going. So it's one of the things I try to do with young people is I try to whiteboard their lives. I try to, say, here's where you are up here, here's where you want to be in 5 years, and these are the different routes you can get from here to there. And I think sometimes when young people come into my office, it's the first time they've ever had anybody do that. So I think as professors are often not very good at, we don't, a lot of young people are clearly not receiving mentoring in the university setting. So I think that's one of the most important things that I try to do, and I think that's extremely helpful. I think another useful piece of advice is you will not be an expert in everything, and try to be. And so when you're doing complicated things like making a vaccine that requires immunologists and chemical engineers and molecular biologists and formulation experts and delivery technology people and economists, you're not going to be an expert in everything. So be prepared to delegate and try to bring people on that can provide added expertise that you can't get on your own. And I actually find that a lot of fun and engaging. I'm often at my age still trying to convince myself that I'm still not too old to learn things. And by bringing from other fields, I've learned an awful lot.
So we have a follow-up question for that about mentoring.
I hope that wasn't too rambling.
Oh, no, actually that was actually very informative. I have to work on my 5-year plan. So how as a trainee can you evaluate the quality of mentorship that you're receiving, and what would you recommend seeking mentorship from multiple sources?
Yeah, I think it's always good to talk to people. I think you can engage the quality of mentoring by how inspired you feel. I mean, if you're coming home at the end of the day and feeling kind of exhausted and burned out and uninspired, I think there's a good chance a significant amount of that is either you're not asking the right questions or you're not receiving the right mentoring. And mentoring is not something you can get passively. You don't want to be over aggressive, but you have to go seek it out. And I have to say, in most university settings, professors and senior people tend to be flattered if a young person says, I want to learn more about what you do. So don't be afraid, especially in big universities where you can get lost. Don't be afraid to make appointments and ask to visit with people at your institution or other institutions. Because people oftentimes like talking to books and papers and or you've been inspired by a speech. Don't hesitate to write to them and say, I'd like to meet with you, or I'm going to be in Seattle in 3 weeks, and I've always wanted to meet you. Would you mind doing that? Or I wanted to, I'm going to be in New York. I'm going to be in London. I'm going to be in Houston, and I've always wanted to meet you. And don't hesitate to do it. And sometimes it doesn't work out. Sometimes it does. I think one of the most game changer experience for me was we had discovered some promising antigens for hookworm, and I always wanted to make a vaccine, but I didn't know how to do it. So I was invited to give a talk in San Diego, and I said, I've always wanted to meet Jonas Salk, and I just wrote to him, and I met with him. I spent an afternoon with him, and I still remember that afternoon spent with Jonas Salk and looking at his second wife's paintings. He was married to Picasso's ex-wife or mistress. And she's a well-known artist in her own right, Françoise Gillot. And that was back in
So
1995,
following
shortly
up on
before
that,
he
what do you
died,
think,
and
looking back
I'll
over your
never
life and the
forget.
mentors you've had, are there overarching qualities that they've all had, or that you can think of that would really make a good mentor, something that people, students could search for in terms of the mentorship?
I've been very blessed to have great mentors. I mean, people like Frank Richards, who died a couple of years ago, was a professor at Yale, and Jerry Shad at Penn, and my PhD advisor was a very impressive guy, Anthony Cerami, and I think the one thing about them is they were scientists, but they also had a vision of the world, and so they inspired me in that way. I think the what I still and to this day I still seek out mentors. So the type of mentor that I've been seeking out lately, beyond mentors in vaccines and people like Phil Russell and Jerry Sadoff and people like that, just about how to make vaccines. Also, I've been trying to learn how to become better at being a public intellectual. That is, writing for the public and engaging the public. Uh, so I don't know if you've ever seen this essay by Alan Lightman, who's a renowned physicist at MIT. He writes this great essay that I encourage everyone to read about the 3 stages of becoming a public intellectual. Stage 1 being kind of, staying in your own field. Stage 2, branching out a bit. And stage 3, being able to comment on almost anything and everything. And it takes time to learn that. And so, for instance, a person like Jeffrey Sachs, even though he's just a couple of years older than I am, has become an important mentor for me. Really just by example about how you engage the public and how you do that, I think is something that,
So I think
at this stage in
there's
my
quite a
life,
few of
I'm
us in the
trying to work
audience
very
who
hard at
are sort
getting
of
better at.
involved in the research end and are looking maybe to try to transition to more of the advocacy policy kind of role. So what do you think are some really key skills that we take with us from research that would be an asset in advocacy, and some skills that would probably need a little bit of work or extra attention in order to make that move?
Well, I think the way I can't speak in general. I can tell you how it worked for me, which is uh, I was an MD PhD in the lab, but
Mm.
not looking back, what I was in fact was a subject matter expert. And so I think the way to begin, and if you look at Alan Lightman's 3 stages of public intellectual public intellectuals or policy or advocate roles, it's starting out as a subject matter expert and not being afraid to write for the public. So, and just get practice doing it. Start, one of the good ways you
Mm.
could start is look at, and it's not the only one, look at the PLOS blogs, uh, you know, where you can write a blog, write for Speaking of Medicine, and just get comfortable doing that. I think is very important. Or writing for the Huffington Post, or writing for one of these other news outlets, and talking about your field and looking at it from the wider context. So I find doing it from the writing angle is a help, especially now with the internet reaching so many people. It has a that's a great way to begin. I think also if you're invited
Oh,
to
we
give a
lost you again.
talk, try to, yeah, my screen sort of blanks out, turns off the sound. I think if you're giving a talk, don't be afraid to enlarge your comments to how your work fits into a wider context of what's happening in society and thinking about science and society. And then ultimately I wrote a book, Forgotten People, Forgotten Diseases, which, although my kids like to call it Dad's Forgotten Book on Forgotten People with Forgotten Diseases, it's now, gone into paperback in its second edition. I found it very gratifying. And that helps you kind of get your message across that you can't necessarily get in a shorter format in a scientific paper. One of my frustrations now is I don't have now being a journal editor on top of everything else for the last 7 years, I haven't really been able to sit down and write a couple of other books, which is what I'd like to do. I mean, I'd love to write Forgotten People, Forgotten Diseases, America. I'd like, talking about disease in the U.S., and I'd like to write more on this concept of vaccine diplomacy. And now that we're making vaccines jointly with the Brazilians and the Mexicans, I'd like to really explore how we can start doing that more with the Cubans and the Iranians and other countries
So we're
that
going to
often
change
the
gears
U.S.
a
is at
little
odds
and
with
have you put your physician hat on. We actually had a question about drug costs here in the U.S. and if that relates to the patent law being too strong or if there's any way to provide U.S. citizens with drugs at lower costs. And then maybe you could relate that to drugs for NTDs around the world and the challenge of developing new drugs for NTDs.
Yeah, this is an area that I haven't been all that engaged in as much as I should. It's just that there's so many good people getting involved in this already. People from DNDI, for instance. Talking with someone who really thinks about this all the time. People like Rachel Cohen at DNDI, or someone like Niels Dallaire, who just stepped down as Assistant Secretary of uh, Global Affairs for the Department of Health and Human Services. That's one area that I've not gone too much into, more because I'm making biologics, making recombinant vaccines, where the patent issues are not quite as dicey, because a lot of our vaccines, the patent issue has become more of an issue for products that have dual use. By dual use, I mean the disease is a huge problem both among wealthy people in the United States as well as in poor countries. I mean, things like for HIV/AIDS or diabetes or things like that. And because I haven't been involved with it at a practical level, I only have
So
a
you
kind of
mentioned
understanding of
earlier
it in
about
abstract. So
the U.S.
I'll kind of
not
defer that
really
question.
potentially doing a lot for our own health here. So someone asked about health literacy and vaccination. And since there are an increasing number of people who are refusing basic vaccinations we've seen from the outbreaks recently, the question is, do you think of a sort of out-of-the-box suggestions and how we can provide for increasing health here in the U.S.?
Yeah, this whole I got kind of involved in the whole vaccines and autism issue uh, over because of the fact that I'm a vaccine researcher and vaccine developer, and yet my youngest daughter, who's now an adult, 21, is severely disabled with autism and other mental disabilities, and was early on willing to come out in a public way and say it's not, autism and mental disabilities are really tough on families, but you know what, they're not related to vaccines.
Mm.
And that put me at odds with a very strong anti-vaccine movement. And I've been impressed with how the anti-vaccine movement still stays strong in spite of overwhelming scientific evidence that vaccines have absolutely nothing to do with autism. And one of the things I've noticed is that um, they the anti-vaxxers tend to, as they call them now, tend to keep moving the goalposts. At first, it was First it was the hepatitis B vaccine, then it changed to, they said it was the MMR and Andrew Wakefield's papers that have been kind of debunked, and then it was the thimerosal, and now that all those arguments are going away, then they talked about the timing of vaccines, and people like Jenny McCarthy talked about the greening of vaccines, and I'm sure once those arguments go away, they're gonna probably go to alum or aluminum in vaccines or something else. So that will keep changing. I think one of the things that's I've noticed is that the U.S. Public Health Service has been somewhat conspicuous by its absence in speaking out against this. So, I mean, our highest ranking U.S. Public Health Service that actually will confront the anti-vaccine community is someone like Bruce Gelland, who's been very heroic in his role as head of NVAC. But, the leadership of the CDC, beyond Ann Shukett, the head of the CDC has not said anything, or FDA, or the NIH, or the head of Health and Human Services. And I think they need to be more out there and vocal about it, because I do think people will listen to our leadership in the Department of Health and Human Services. We don't even have a Surgeon General right now, but I think it's a priority to bring on a Surgeon General who's willing to speak out about those issues.
So we only have a few more minutes left, because we don't want to take up your whole afternoon. I'm sure you're very busy. Just briefly, okay. So we have two brief questions. One regarding the presence of your initiatives, which I'm assuming is the Hookworm vaccine and the Sabin's efforts in Africa, and the extent of that coverage.
Well, there's a few things that are happening. One is we have a very exciting organization at the Sabin Vaccine Institute known as the Global Network for Neglected Tropical Diseases, and this is an advocacy-based organization that's trying to heighten awareness about NTDs, to work with European parliaments and governments to continue to support NTDs as well as our own government, but at the same time working with some of these big disease endemic countries. So there's been a lot of excitement that the Global Network has been doing in India, getting some of the Bollywood stars like Abhishek Bachchan involved to raise awareness about neglected tropical diseases, and doing it at a very grassroots level, meeting with people with lymphatic filariasis, trying to remove some of the stigma associated with these diseases, and I think that's extremely important. At the same time, the sister organization is the END Fund, Ending Neglected Diseases, that is raising money for NTDs in areas where USAID and DFID are not able to support programs, places like Mali and elsewhere, and I think that's been extremely important. So I think really expanding the opportunities for implementation of the Rapid Impact Package and getting all of the bottom billion who need these diseases on medication is going to be absolutely critical. But in parallel, one of the things that Sabin does, and Sabin's kind of a unique organization, working with our National School of Tropical Medicine and Texas Children's Hospital, is that it recognizes that implementation alone is not sufficient, that we still can need a parallel programs of R&D for making new generation tools. And that's something we're doing here in Houston at the Sabin Vaccine Institute and Texas Children's Hospital Center for Vaccine Development, making new vaccines for hookworm and schistosomiasis, which are in the clinic, and then newer stage vaccines for things like Chagas disease. We are
just about out of time. So I wanted to say thank you so much. We really appreciate your time. It's been really, really great to talk to you. Very enlightening. We have a bunch of messages about how much everybody has enjoyed your answers. And thank you again. And hopefully we'll see you soon at the ASTMH meeting.
Thank you. And I'd like to thank again the American Society of Tropical Medicine and Hygiene, which has really been at the forefront of getting the word out about these diseases, and an extraordinary job to the leadership of ASTMH for keeping so many things going, and again, keeping an extraordinary annual meeting
All right, thank you.
going, and
And
hope to see a lot of
thank you
people in
everybody
New
for
Orleans,
attending, and
this
I'm going to leave my email address. Please feel free to give feedback, suggestions, and let us know who you'd like to hear from next. Thanks. Bye.
Thank you again. Bye.